So thank you everyone who has made time to be here. I'm really excited to be talking to Jean-Pierre Faber this evening. And I know that either you've looked him up on LinkedIn or are doing that as we speak. So I'm not going to go through a long, explanation of his career. I'm sure most of you know that he works at the CSSF, which has been in the news quite a bit today. And we're very pleased to have him talking to us about how the CSSF got their people back into the workplace and the process they went through and are still going through to do that. So he has assured me that if anyone wants to connect with him on LinkedIn, he's happy to, say hi and accept that connection. And I think, Jean-Pierre, shall we get started?
Yes, gladly. Go ahead.
Okay, so Jean-Pierre, thank you so much for joining us. This is a really interesting topic right now that is under discussion around the world. And I just realized I didn't introduce myself, so anybody who doesn't know me, catch up with me later and I'll tell you who I am. This is a topic that is really, it can be very polarized. Some people are saying, why do we have to go back to work? I'm worried about that I'm in a risk group, or some people are saying, oh, I can't get back to work soon enough. So what were some of the things some of the elements, if you will, that your team considered when you were hatching the plan to get people to come back to work?
Well, at the outset, I think we had created what we would call a COVID-19 committee. And that committee is composed of people from HR, the lawyers, people from the communications team, IT, and facilities management. And that group has been active ever since we've started to send people home. And we've been actively on a daily basis trying to keep people informed about what's going on, and that they also felt part of the community of the big family of the CSSF. And we came to realize, obviously, it was actually easier to get people to leave than actually getting them back to work. So once we realized that the government was going to free up the conditions, we realized that we also needed to think about reintegrating the people. And we set up what we called a reintegration booklet. And that booklet basically set out a few concepts about one, reassuring that the buildings that the people would reintegrate were safe, that there was a protocol in place for cleaning, for disinfection, that there were features provided by us to our people to continuously disinfect their areas if they felt it was necessary, the distribution of reusable masks. So all the elements about safety and that they could feel comfortable cutting back. Secondly, the house rules. The house rules had to change, obviously, so we followed also the guidance of the governments by putting in circulation maps, by reducing the amount of people who can be gathering together. And within the office, we actually said, well, we're going to visually, on plans and actively on the office desks, put stickers. And the one stickers were saying this is a usable office desk and the other ones are not usable, so that the people would understand visually immediately where they could sit down.
Okay, I have to ask. So you put stickers on some people's desks that told them they couldn't use their desk anymore. What did those people do?
They, at the beginning, obviously, there are some who are saying, I don't care, I'll take the one which is my desk. So at the beginning, it was a lot of talking, trying to make them understand that the protocols of safety are applicable to everybody. And it's not because they're alone in their little quarter that they have to not respect those rules and so on and so forth. So obviously communication is one thing. Secondly is to be there to guide people. Thirdly, which we didn't have to do, fortunately, is then to become much more in the modus of sanction. So that was an option we had, but we didn't need to utilize. That was absolutely necessary. Food distribution was something which was important also to provide people guidance around that. So we set up a schedule of when people could go, so that there were not too many people at the same time and being able to go through the office canteen. And we also allowed them to take their stuff to their desk, which was a conformed desk, which is unusual in the usual use of our office space.
I'm going to ask about that too. So I have quite a few clients that have done a similar thing. They've staggered lunch hours or break times, and they've allowed people to bring food back to their desks, which is fine if you have the food wrapped up. But what kind of sanitary approach did you take? Like, are people walking then through your office with a tray that's open with food on it, or?
Yeah. So we obviously had to talk with our supplier, and we had already initiated a program to be more ecologically responsible. And we actually used reusable dishes, which were then also hermetically closable, so that we could guarantee that during the transportation time, nothing would spill over and get all the shirt dirty or whatever. But then also that they would also get through the normal walking space area, which was then freed up. For example, usually it's a time in and time out aspect. So we actually killed the whole process of people having to go through, what's the English for that? A tourniquet, to actually go in or go out of the kitchen area. So we just basically said, well, given the situation, we will not discount the hours or the minutes that they are spending in the kitchen area. That was something that was necessary to do. And then obviously we had to set up places where people could deposit their used items. So we had to demultiply the collection areas and get a process into place with the supplier, so that would be a rotation and a cleaning up aspect also.
So you're talking a lot about the different approaches you can take to food safety, to circulation safety. I have to go back. When you mentioned you had your team in place, one of the people on your team was a legal person. Can you tell me a little bit about that? Why would you need a legal person on the team?
Well, there are three aspects. One is obviously we were in a new man's world because there were specific laws which came about. We were in a state of emergency, something which is unusual also. So we need to understand what are the powers given by government and what is the enforceability of those laws. Last but not least is we are in the public sector, and the public sector have different rules to what you usually come about in terms of working conditions and so on and so forth. So we had to make sure that we wouldn't get into an unnecessarily discussion of criticism from the unions. That was one aspect. But the other aspect is also to make sure that when we were formulating communication, that we were formulating in such a way that it wouldn't be making people worry, or respectively making us attackable when people were reading what we were reading. That doesn't mean that we didn't get questions. And that was something which was critical also in this daily communication process, was that we got questions and we were very responsive. If we weren't individually responding to people, we would then collectively responding the following day or the 2 days later vis-a-vis of questions which came back. So it was very much a two-way communication process that we had in place.
Okay, and that that mirrors many of the other conversations I've had with people in different organizations that say communication became one of the most important aspects of the isolation and lockdown period, and they needed to continue that as the people started to return to work. What's interesting for me is that almost everyone I've talked to cites communication as something that would help lower stress. And a lot of what you've talked about so far, the measures are kind of what I would classify as facility measures, the circulation of the office, the blocking of the desks. Did you do anything to address issues like mental health or, things like that?
That's a very good point. Obviously, we realized within the beginning that everybody was very hyped to be working in new environments. We had new technology that we had rolled out, so people were excited by using Skype for Business or WebEx if it was for external meetings and so on and so forth, because we wanted to portray that the CSSF didn't close down and that we were accessible and they would continue to do our review of clients which had questions about getting and being set up in Luxembourg. But we also started to realize very quickly that people started to be anxious by being in an environment where they were not exchanging with other people. We even had requests from people who were saying, look, I'm not going to be able to do this staying at home. Can I come back to work? And obviously, having 15,000 square meters and 517 workstations for 960 people, it was possible to reintegrate people progressively. So we did that on an as-needed basis. But what was also important was we tried to get a feedback through a formal process of a survey. So we did a COVID-19 assessment survey, which was also an engagement index survey to understand in which sense people felt that we were communicating well, in which hierarchy levels the communication was going down, what was the stress level of working, were they working more, were they working less, were they working in good or bad conditions, and so on and so forth. And were there team leaders actually going by, managing them being as proximal or as close to them in the right proximity within the new environment of being remotely only joinable. And that was something we felt was important. We also were looking at the hours people were actually working. How did we do that? We had an e-badging system that we put into place so that we had an ability to capture how the people were progressing in terms of their workload. And so we had always the outliers, which were then being actually contacted by their team leaders to see, okay, what's going on? Is it because you've got too much work, or is it because it's too complicated? Is it something else? So that we got a feeling if they were feeling well. The last measure we did was actually, we worked with the psychological help of the public function to allow them to address questions. So we actually had some typical FAQs, and we invited them to certain stress seminars and about how to self-heal oneself vis-a-vis of creating 3 zones. One zone where they're working, one zone where they're at home, and one zone where they were relaxing. Because it was very confusing for many people to be in a short period on such a small-sized environment, and they're not having the possibility to actually dissociate private life, working life, and the relaxation area. So that was something we were very active about.
Yeah. Did you, it's interesting because there seems to be quite a split between, and by the way, for the people who are listening right now, feel free to add questions into the chat. Ainsley's going to consolidate them all and go through them with Jean-Pierre. So feel free to do that. One of the things that I've noticed in conversations, and I think you're aware that we had a kitchen table in July around the stress of remote working and how organizations were coping with that. So it seems to be that there were some people who just couldn't wait to get back to work because they didn't have the right plan at home to be able to have private space, to have conversations, business conversations that might be confidential. They were, sharing a space with different people. Could you speak a little bit about, did that come into your planning process? Did you consider, okay, well, these are the people who've said they're not, happy working from home, so let's bring them back first, or?
Well, from May 25th onwards, we actually put in a rotational program where the team leaders were made responsible to have a rotation over 2 weeks. Why 2 weeks? Because obviously there was this medical indication that you need to keep Group A and Group B apart, and there would be a risk of contamination over 7 days. So that's what we did. That was point one, is that we didn't do any strong recommendation other than getting people on a rotational basis to come back. And some team leaders then decided to actually, because of the size of their teams and not because of the cohesion of their team members, to do it on a weekly basis. So we had to adapt and to allow them to get that done, but it helped because it created a new cohesion within the teams, and they felt belong again in the same family. And they were able to have more, I would say, the normal chit chat that they didn't have on a daily basis, because when you're on an Skype call, very often it's very, to the point, get things done. So the productivity in that sense might have gone up, but the empathy of being then in a cozy work environment was lost. Something which is also true is that that rotation brought with them the ability that people had safety about where they would be working. So we put into place a booking tool, like a hotel booking tool, which was very straightforward, and where people would say, well, okay, good, you're coming back, here is your system, you're going to be assigned a seat, and that seat is going to be assigned within your normal geographic area, within your working environment on the given floor and the given building. And that was also something that brought people a certain safety of returning back to the office, because they knew they were staying with their people within their team, where they were comfortable within that team because they knew each other. It being a large organization, obviously, what happens often is that people don't know each other anymore. So they were concerned that they would have to end up with people that they didn't know, and they were saying, well, I don't know him, I don't know the family, I don't know their way of living, so maybe I'm going to expose myself unnecessarily to some health risks. And that was something that we were able to compensate mechanically, if you want, through a booking tool.
Oh, that's a really good way to do it. That's very interesting. And as far as, so one of the things that we were talking about recently is this, many of the buildings now, you can't open the windows, and they say that, you know, if you're in a closed environment where the windows don't open, you should really be wearing masks while you're there. And the feedback that I hear from a lot of people is that it's not so comfortable to wear a mask all the time. So how did you deal with that?
We have very strict rules. The moment people got out of their car or got into the building, they had to wear their mask until they were sitting at their workstation. Once they were at their workstation, they were allowed to take off their mask if they wanted to. They were not obliged to, but once they got up from their workstation, they had put on their mask. Okay. We didn't push too much team meetings because we had our technology. So on the other hand, then we distributed some earphones so that people would get then used to having their Skype calls, so using earphones instead of screaming into the laptop and putting the microphone or respectively the loudspeakers at max volume, and everybody was disturbed in the process. So we had to go through that education process also. And we are not there 100% yet, but that's going well. So the mask was something which was also reinforced with reusable masks. So we actually told people when they came, they had the welcome kit. The welcome kit had the different house rules. They had also their reusable kits. They had also their little widgets to help them open doors or press buttons in the lift area and so on and so forth, so that they were really well equipped that if they wanted to, they could at any moment avoid touching areas they didn't want to touch. And then everywhere when there was a circulation, be it in the men's room or the ladies' room, or be it at the lift area, or be it in the cafeteria area, there were hydroalcoholic distributors so that they could disinfect their hands on a regular basis. So that was part of the whole process of giving them that assurance that they can feel comfortable.
It sounds like you went through quite a pragmatic planning process to so many bases, to cover so many bases, and you have quite a large employee population. But generally in Luxembourg, we have so many nationalities in the workplace, no matter where you work, whether it's a small office or a large office. We just have so many nationalities that we're dealing with. Did you find there had to be different measures or responses for the different nationalities, or did you find it was quite the reaction to your communication and the measures you set out was quite consistent throughout?
We have a population which is comparatively to the private sector very, very straightforward. We have 50% of Luxembourg nationals and the other 50% which are not Luxembourg nationals, and there are about 80 nationalities where the main nationalities are being French speaking. So that's point one. So in terms of communication, the straightforward communication was often done in French because the expectation of anybody working at the CSSF is that they speak English and French fluently. That's a given. That said, we have now an increased amount of German speaking, so we've started to communicate in English. So all the more critical ones, or those sets of communication which were maybe difficult to understand if you're not a native in French, then we did two languages. So that was then French and English. Not in Luxembourgish, you might be surprised, but because obviously, even though they are all meant to be understanding and speaking Luxembourgish, not everybody got the same level today, and we didn't want to get any miscommunication out. I would say it's an enforcement side where it was more complicated. The communication part was straightforward, but when we saw how people lived it, that's where we saw the differences, and that's where we had to be a bit more hands-on with certain nationalities.
I have to ask, would you have one example that you could share with us of being more hands-on? Not to put anyone on the spot, but you know, a story. I'm always after a story.
Well, one story was that when we put out the distribution of the alcoholic gels, the hydroalcoholic gels, was that some started to disappear. And we tried to find out what was going on. And it was a gender issue for one, and it was also a nationality issue. So we suddenly start to realize that there was a community which is going towards the south of Luxembourg, which were very much concerned that they wouldn't have enough stock for themselves. So they started to reserve themselves by taking the stuff which was lying about, or the special bacterial lingette antibacterienne, I don't know how you say it in English, sorry, then they were also starting to see it. So we had to go back and find out, and we had to talk to people, and we found that they suddenly reappeared. So we did a deal with the people saying, we put them in an area where there's no camera, where nobody can see you, and if you want, you can just drop it off, and then we will reuse them. And some started to reappear. Yeah.
It's like a gun amnesty for disinfectant.
But it was surprising at the very beginning to see that kind of reaction, which I understand fully, because there were no masks which were good, available in quantity, and the gels all went all sold out. So I mean, you can understand it, but in terms of community, you have to think about all the others who are also working with you. So that was an interesting feature.
If you think about like when the lockdown was approaching, no matter what country you think about, there was this urgent motivation to hoard products, whether it was food products or hygienic products. I wonder, so when you tell that story, I think, well, that's part of the, be prepared for the future. Did I buy enough toilet paper story, right? And I'm wondering if everybody went out and cleared the shelves of toilet paper. Everyone saw the pictures, but my cousin in Canada sent me a picture of a local store, which was hilarious because there was no paper products at all, which is funny for a Canadian for so many reasons, but we won't go into that. But have you found that hoarding mentality has carried over into the office? Was that just one instance that was, a singular instance, or have you noticed other changes in behavior from, being isolated for all that time?
So the hoarding part vis-a-vis of the products, I think that's something which resolves itself over time, because the masks and the gel came much more available and everybody was reassured. And we also were communicating about those measures, that we had enough stock, so that people were feeling they're comfortable about that. So that was something which was a complicated item during the whole process, because we were trying to find reliable stock with reliable suppliers and at a reasonable price, because everything was becoming unpayable. When people started to come back, actually, it was that they were very concerned actually to meet with people. They were very much more trying to stay isolated. They didn't want to get too close to each other. And now, in the meantime, what we've come to realize is they've become familiar in this new norm, or the new normal. And now we have to remind them, like you were saying earlier on, to put on their masks if they're working together, that they have the reflex that if they're coming too close to each other, that they put on their mask, and so on and so forth. So that's where we're having now a change of mentalities, that people, some, not all, but some people have become reckless because they are not respecting the good sanitary rules to keep everybody safe, themselves included. And so that's where we sometimes have to go about and just remind people kindly, well, please respect the house rules and the distance and wearing your mask. Yeah. That's more negative, unfortunately.
Yeah. And sometimes that's all it takes, because it gets very difficult. You get lost in work, or you get lost in a conversation, and then all of a sudden you realize that you're not a meter apart, certainly not 2 meters apart. So yes, it's a very interesting situation for sure. I'm going to turn over the reins to Ainsley, who I hope is being able to consolidate some of the questions. We've had quite a few, and she's going to just ask some of the questions, and and in about 5 to 7 minutes, and then we'll come back and have a wrap up. But anyone who wants to stay on, this is a kind of a true kitchen table that we are going to do breakout rooms and let everybody get together and chat for a few minutes afterwards. So don't run away. Ainsley, would you like to do the questions now?
Mute. Yeah, so there was some questions, a couple of them in the same range of ideas, which were, how are you adjusting or taking into account different definitions of risk for the countries surrounding Luxembourg, France, Germany, Belgium, and employees coming from those places? Or how are you dealing with different regulations, like if different countries have different quarantine rules? Are you just allowing people to work from home if they're expected to quarantine in one country but not the other?
Okay, they're good questions. So what we did is we created a set of protocols. So we've got 3 in place at the moment. So one which is quarantine related. So independently, if the person comes from France, Germany, Belgium or Luxembourg, once they're quarantined, they have to stay home for 14 days. The law is obviously going to change next week, or this week, sorry, based on propositions by the government. That said, so the first 7 days were quarantine, and then the second set of 7 days were in self-isolation and self-monitoring. The quarantine difference was that they were medically speaking on a sick leave, so they were not obligated to work. The second protocol was with people who were exposed to symptoms of sicknesses associated to COVID, where we then said that people should go home and work from home and do an auto control for 7 days. And then obviously we had the circle 1, circle 2, and circle 3. So if patient 0 is the positive one, circle 1 is the people who are exposed, which is protocol 1. And the circle 2 is the people who were then exposed to the circle 1. And that was a bit more on a difficult setup, because the circle 1, they were in quarantine, and circle 2, they were in auto control for 14 days at home. We've become more pragmatic, because at one stage we nearly had everybody which was going home, and we've been also following up on how many cases have been positive. So we have an active monitoring where people are being followed up on, and they're being said, well, look, my result is negative. And the moment people become negative, then they're basically allowed to reintegrate the office space. If the people can't have a test done, and that happened a few times, well, then we just said, you don't come back. That was a measure of precaution. People coming out of zones, especially that was the case when people came back on holidays, and we told the team leaders, well, if you have people who are coming out of a zone and you're not comfortable, then tell them to stay home. Tell them to stay home for 7 days, or get them tested within 5 days, and then if it's negative, let them reintegrate based on the reintegration program that we put into place. So that's that. And then if people are now traveling, because we're starting opening up again that people can travel, and they're going into a risky area, then the same protocol is applied, like if they have been in a risk area, which says then you stay home, have a test done, and if it's negative, come back.
Another question that came up was about onboarding new employees. So people who have just started a new contract during the quarantine time, how are they getting integrated into their new work lives?
That's a very good question. So originally, if people get hired, they have an integration program of week. And then after the first week, they get handed over to what we call a maître de stage. So somebody who's got the responsibility of integrating them within the team and within the work they have to do. Now, during the lockdown period, obviously that was not possible. So people who came in, they were sworn in as a public agent, and then they were basically sent home with their laptop, and they had to get managed remotely. And in the meantime, what we did is that when we had people who started, is that their team leaders will have to be on site, and they have to take care of the people that being integrated, keeping obviously the appropriate distance. And also from an IT perspective, from an HR perspective, from a communications perspective, from a security at work perspective, from an GDPR perspective, all those specific modules that people have to go through have been reintegrated into a normal schedule. And so the training has been reinstigated, but at a certain distance one from each other. And then teams have to actually be split up into 2 or 3 or 4 classrooms with 2 or 3 or 4 teachers who have then to be actively put into place to train the people. But that's what we've done, so that we're getting back into a new normal. Yeah.
I guess that leads into another question that came up was with management, how are you ensuring balance between surveillance and support? You were talking about, you brought up sorry. You were talking about how managers are looking at the productivity of their employees, and that you put in some and the uptake of the new rules with the employees. And you talked about how sometimes you had to enforce the rules with sanctions. So there can be a push and pull between like supporting people in actually following the new guidelines versus sanctioning them when they choose not to follow the guidelines. How are you striking that balance?
Well, it's a complicated balance, because unfortunately what we came to realize, and it's not the negative, is that very smart people, when they are faced with fear, it's like if you would switch off their brain. And we saw some very primitive reactions. So people, give you an example, oh, JP, he's been coughing. I'm sure he's sick. You have to send him home. And they come and they became insistent, say, send him home. So we came into a situation of saying, well, this is becoming crazy. So we have to tell people, I think you should go home because I think you're overreacting. That's point one. Point two is, obviously, it was up to us to show a lead by example. So the management team had to come back with the team leaders into the house, and that we also talk to each other how we would go about. Thirdly, the COVID-19 committee were confronted with practical questions. Can I do this? Can I do this? Can I not do this? What should I do in this case? So we were really very pragmatic. And in some cases, we actually then did an FAQ in the next communication saying, yeah, you had this situation, this is what we expect you to do. About the sanction part, like I said, we've been very fortunate. We haven't had a situation where we had to go as hard as going to notify people that they were disrespecting the rules. Usually a reminder was sufficient by the team leader. And if the team leader was too concerned, then we answered, well, should we do it for you? And then we did it for them.
Interestingly, you said that when people are afraid, they act differently. And as we come into the winter, things are going to change, and there's an expectation of another wave that is potentially going to be as bad as the spring or worse. Are you taking into consideration the way things will have to change as people need to be in more enclosed spaces with the change in the weather and more often?
Well, we were very fortunate that the infrastructure, the technical infrastructure of our building is relatively recent for both buildings. So what we did is we actually followed the regulation of actually only bringing in fresh air. That's point one. So the recirculation of used air is not possible. And the circuits being separate allows us to also confirm. So we're actually having testing which is being done without the staff members knowing this. Do we have presence of COVID-19 molecules within our systems? So that's something which is just a precautionary measure that you can take, but you have to have the infrastructure that allows you to do such kind of measuring. Yes, we have concerns, but at the same time we have, like I said, more workstations which are okay vis-a-vis of social distancing, then we have actually people coming back if we have a rotation over 2 weeks. So we know we're going to reach around a level of 450 people max present on site, and the others are going to be at home. The one measure which is obviously now we have to learn to play with is the one about congé pour raison familiale, which is associated to when parents have to take over the responsibility of taking care of their young children up to 13 years when they are actually exposed to a positive case. And there's a lot of questions which are going to go about that. So this is a topic we actually were discussing in the executive committee this morning. So how shall we go? Can we be firm? Should we not be firm? Should we do a case-by-case basis? And so that discussion's not over yet, because obviously everybody's got their viewpoint. We are 960, so, and they are not all trying to avoid to work. That's not the point I'm trying to make. But what I'm saying is we have always those 10% of people who will always try to abuse the system, and you have to make sure that the other 90% who are playing by the book and by the rules and who are very committed, that they don't feel that they are being misled by those other 10%, and the other 10% can undermine their work and their work ethics. So that's where we are at the moment on that part.
And I guess that sounds like the question of the day is does the CSF plan to embrace more homeworking in the future in comparison to how much homeworking was embraced by the CSF before the pandemic and the lockdown originally?
It's a very good question. I think we need to segregate about the situation, which is a COVID-19 pandemic vis-a-vis of the normality. And the new norm will be obviously that people are able, given the circumstances, to work from home, yes. Have we been against it? The answer is no. Do we think it is an ability to do it at the large scale? That's up to every employer to decide what is that scale. Will we limit it? Yes, we will limit it, because obviously we need the substance. We need to make sure that there is no question about the activity, the economic activity being done on site in Luxembourg for various reasons, be it the criticism of Luxembourg internationally, be it also vis-a-vis of the economic nature, which would then disqualify the headquartering or the subsidiary being based in Luxembourg and so on and so forth. So there are a lot of questions which come about it. But last but not least is we need to have the right people who can take the decisions. They have to be here in this country. And that is something we will not negotiate. That's something where we'll be very firm. So it's up to the employers to see how far they want to go. Will it be around 50%? Maybe, but that's up to each employer to decide. Will it be more than 50%? No, definitely not. I don't think that would be reasonable. And we don't want to have the situation where the key activities be done in London, and afterwards then we find out that there's a problem about taxation, and then there's a problem about reputation, and then we are back in the whole scenario that we've been trying to rebuild since about 2013 to say Luxembourg has actually taken serious measures to be not a tax safe haven and not a letterbox environment. So that's something where we'll be very, very vigilant.
That's really interesting. Thank you so much, Ainsley, for consolidating all those questions. And we've got just a few minutes left. Is there anything, Jean-Pierre, that you would like to add before we wrap up?
Well, I think we were touching on the last question about home working. I think home working is a new norm. It's something that we also will implement within the CSSF, providing the function is eligible. So, for example, if you are in a secretarial function, yes, you can work from home, providing you have the right technology and you can follow up. But if you are in a more down-to-earth office management role or facility management role, well, obviously, no, you can't do some home working. It's very obvious that that's not going to be the case. We will think about 1 day a week as a pilot. Obviously, there's going to be a monitoring about how this is going to go about. And so we think that those are some house rules which are good for the public sector, which should also be good for the private sector. So if we allow people to do home working, set aside the whole question about the technicality about how many days they're allowed to work from home from a fiscal perspective, from a social security perspective, from a pension perspective. I think that's not what we should be debating at this stage. That's not our responsibility anyway. But we think that there should be a balance. There should be a balance, but there should be a balance with control. And that's up to every employer to see how it does it within the rules of the work contract. What I'm not saying here is that everything is good to go and control if people are working at home. No, that has to be done within the framework of legality. So that has to be very, very well understood. And I think there are enough means necessary today to actually understand if people are being productive, if they're doing their work, and how they use their day given the schedule of their clients, or give it their schedule within the working group they're in, or within the schedule of their family responsibilities. That's up to everybody to decide how they want to do it, and everybody has to be happy. And if it's a lose-lose, well, then it's very simple. Then the home working is cancelled and people come back to work at the office. That's it.
Well, yes. Well, we'll hope that everyone abides by the rules and keeps everyone safe. I find that Luxembourg, more than ever before, I feel a sense of community here where people are really pulling together to really make a difference. So it's nice to be able to talk to a director in a company that has really put a huge amount of thought and planning into making sure that not only that you've taken as many measures as possible, but also you've tried to reduce the stress of your staff as well, which mental health is very important. And we will touch on that, I think, in the kitchen table on Thursday. So just as a wrap up, I'm going to do 3 key messages because of course there's been many, but one is communicate, 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 both ways in many languages with different modes so that you're hitting everyone. I also thought it was interesting when you were talking about how you've made changes to the circulation in your building. It's like you're planning the walk, right? So what walks do people take? Plan your walk. And I love the idea of the welcome kit. I've spoken to so many people in the last few weeks, especially, that are really worried about things like touching door handles or moving between different parts of the office. So it's, again, very interesting that you have come up with a solution for that. And maybe we could get you to share a list of what's in your welcome kit. So thank you so much for sharing all this information with us. As normal, we're going to have breakout rooms, and very kindly, Jean-Pierre has agreed to stay on. So if you're lucky, you'll be in a breakout room with him for about 5 minutes. If you have to go, this is the end of the program. If you haven't signed up for the kitchen table on Thursday and you found this interesting, please feel free to go to Tyoch and sign up for that. I'd like to thank Darren Robinson, who is the co-sponsor of this event and the whole series. And now we'll get Ainsley to put us into breakout rooms just for 5 minutes, and then we'll come back. Okay?
Great. Thank you so much.
So what did people find in their breakout rooms? What was the discussion on? One of the questions, Jean-Pierre, in our room, which was, I know we've talked about quite a bit in our little group, which is, why do we have to go back to work at all? Why do we need offices anymore? And you had an interesting take on that. So,
well, we have the fact that people need to interact and that there is a social balance which is found, that they're belonging to a team and that they have a DNA associated to the corporation. Secondly, we have to learn one from each other. So there's a question of how we can better improve our sharing of information and working on specific new regulation. And that does not work if you're doing it virtually. You need to do it within teams. Thirdly, we think, I mean, it's very humble, but we think that if we don't have people interact, we will lose in our efficiency, very simply because there's a demotivation factor. And what came out of our study, we had done this engagement study, was that everybody wants to continue on home working, but not too much. They actually said exactly the contrary to what I expect. He's saying, blimey, I'm going to stay home 80% of my time. No. It's just the contrary. Saying, yes, I'll do 20%, but not more. That was something which was a big surprise to all of us. We expected something very different.
Yeah, it's interesting to me because I work with such a diverse client base, and I hear similar things. There's people that couldn't wait to get back to the office, extroverts, very social, but even people who would be considered, less social and more introverted. At some point, I've heard almost everyone say, I need to get back to the office. And an interesting topic that we'll cover in the future, maybe Thursday, but probably later, is one of the key things that keep coming up with my clients is from the employee population when we do the kitchen tables is how do we get ahead? How do we get promoted? If we're not in the workplace, how do the managers see us and how do we shine? Because that's, you get promoted by accomplishing things, but also by being in front of people. So we've got a really interesting set of dilemmas to move forward on. And certainly since this is not going to be solved, in the next few weeks or even months, we certainly have time to work on it.
So we are planning nothing before April, and it's actually going to be most probably much later. If you listen to Dr. Fossey, I'm not saying he's the right person to listen to, but he said that we shouldn't plan anything before the end of the year, 2021, which is reasonable. And if you look at the medical, my parents being doctors both said, to stop kidding
July
yourself, because
2021.
it's a 3-year process. So
Yeah.
doing it in 1 year is already very surprising. But if everybody works together from all the communities, I think then obviously you can do much more than in the past, because there is here a pandemic response that has to be provided by the economic actors, and then obviously at a reasonable price. Not that we have the same dilemmas with AIDS, where everything became so expensive that some communities were not able to access that kind of treatment. Yeah,
absolutely. Jill, you had your you were waving there.
Only because it's just come into my mind, and I don't think it was mentioned today, but maybe the great gender barrier has been broken by this. What do I mean? Women were singled out as the only ones who probably had a reason to work from home. There were children and this, that, and the other. But I think what the pandemic showed was that from a personality, some people like to work from home and some people don't. So it's not the stigma of being female and having to have a really good reason to work from home. It's just whether your job would allow you to work from home. And so I think we're all in the same mix. So that might be a real positive that's come from it.
Yeah. Anyone else have anything to add? We're a small group. You can just unmute and wave your hand, and then we will wrap up because, you know, we said it would be short.
Yes, I have a question, because obviously we all think that we are not as productive as we are when we come together. Nevertheless, I would like to challenge that, in that sense that I think most of the tech companies, you know, they do not necessarily come together to be innovative. So is it something that you think we still need to develop, which is very much my point of view, and how do we actually support that? Yeah, because I think one of the challenges that Jean-Pierre also mentioned is, are our department heads, our team leaders, you know, are they really ready to lead remotely? And I think this is one of the biggest challenges, to upskill everybody, and not only the leadership, but also the people. You know, how do I behave in front of screen? How do you have a conversation on screen? And we are only in the beginning of that. So I would be interested to hear, what do other organizations do to really prepare their people for a time where working from home will be with us for probably ever.
Yeah, and actually it's not like, this isn't new. When I stayed home with my kids when they were quite young, but my first job back into the workforce, I was manager of client services for a consulting firm, and I had 25 centers that I looked after in the Greater Toronto region. And of course I had staff, I think I had 40 staff, and I wasn't with any of them. I was running, you know, all day long, all week long. You know, I would go to events at centers. I would have client meetings and bring along the account manager for that client, of course. But this was an interesting thing that started popping up with some of my clients in the spring. The managers were quite stressed about, how do I manage people remotely? But it takes a shift, because I think especially here in some companies, the measure of people's productivity is actually their attendance. And so how I managed my staff all those years ago was, we had deliverables. We sat down at the beginning of every month. I saw what their schedule was. I saw what their deliverables were. And if they didn't deliver, we had a conversation. But all my staff did deliver, because they knew that was the expectation. And I didn't look over their shoulder. And I think that this, one of another benefit of the isolation and quarantine period is that people are starting to think seriously about, instead of measuring people's accomplishment by the amount of time they spend sitting in a chair, they're now starting to look at, what are my people accomplishing, and how are those goals tracking against where the company is going. So yes, a very important discussion. And Astrid, I'll tap you for that with you know, when we have a kitchen table on that. That should be very interesting.
Thank you. Yeah, with pleasure.
So any other comments before we wrap up? We're good. Thank you all for joining us. This has been wonderful. You can find the other two sessions on the Tyoch platform. If anyone knows of an HR person, I've just received a cancellation from one of my panel members for Thursday. So Astrid, I might be calling you.
Depends on the topic, but let's take it offline. Yes, with pleasure.
Yeah. So thanks everyone for coming, and hopefully we'll see you at the next kitchen table.
Hope so.
Thank
Bye-bye.
you. Bye-bye.
Bye-bye.
Thank you. Bye-bye.